This medication, Microgestin Fe Tablet, is used to prevent pregnancy. It contains two hormones, norethindrone and ethinyl estradiol. Additionally, there is a small amount of iron in each of the 7 inactive tablets taken during the 4th week. These inactive pills do not contain any hormones, but they are included to help you stay in the habit of taking 1 tablet each day. However, they do not have enough iron to treat iron deficiency. In addition to preventing pregnancy, this medication may also make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect you or your partner against sexually transmitted diseases. When taking Microgestin Fe tablets, it's important to follow the instructions provided by your doctor or pharmacist. Take the medication by mouth once daily at the same time each day. If you're taking the chewable tablet, you can either swallow it whole or chew it thoroughly before swallowing. It's important to continue taking the medication exactly as prescribed and not to skip any doses. If you experience vomiting or diarrhea, it can affect the effectiveness of the birth control pills. In such cases, you may need to use a backup birth control method, such as condoms or spermicide. If you experience stomach upset or nausea, taking the medication after your evening meal or at bedtime may help. Each pill pack contains 21 pills with active medication and 7 reminder pills with iron. You should take 1 active pill daily for 21 days, followed by 1 inactive pill with iron for 7 days, unless otherwise directed by your doctor. You should have your period during the 4th week of the pack. If this is your first time using this medication and you are not switching from another form of hormonal birth control, you should take the first tablet on the first Sunday following the start of your menstrual period or on the first day of your period. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy. If you are currently taking medications that can interact with iron, such as levodopa, levothyroxine, penicillamine, tetracyclines, or quinolones, consult your doctor about whether you should skip the reminder pills containing iron. If you have any questions or if any information is unclear, consult the patient information leaflet or your doctor or pharmacist for more details. Side effects of Microgestin Fe Tablet may include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If you miss 2 periods in a row, contact your doctor for a pregnancy test. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. This medication may raise your blood pressure, so it's important to check your blood pressure regularly. Serious side effects may include lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, yellowing eyes/skin, and rare but serious problems from blood clots. If you experience any of these side effects, seek medical help right away. A very serious allergic reaction to this drug is rare, but seek immediate medical help if you notice any symptoms of a serious allergic reaction. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. If you have any concerns about the side effects of Microgestin Fe Tablet, do not hesitate to reach out to your healthcare provider. If you smoke cigarettes or use tobacco and are over 35 years old, it's important not to use Microgestin Fe Tablet. Smoking can increase the risk of serious health problems such as stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control. The risk of these problems increases with age and the number of cigarettes smoked. It's important to avoid smoking or using tobacco while taking this medication. Additionally, it's essential to keep iron-containing products, such as Microgestin Fe Tablet, out of reach of children as accidental overdose can be fatal. In case of overdose, it's important to seek medical help immediately or contact a poison control center. It's important to talk to your doctor or pharmacist before taking Microgestin Fe Tablet if you have any allergies or medical conditions, such as blood clots, high blood pressure, diabetes, or if you are nearsighted or wear contact lenses. If you have diabetes, it's important to monitor your blood sugar regularly and let your doctor know if you experience any symptoms of high blood sugar. Before undergoing any surgery, make sure to inform your doctor or dentist about all the medications you are taking. It's also important to note that this medication may cause dark spots on your face and skin, and it's recommended to limit sun exposure and use sunscreen when outdoors. If you wear contact lenses, you may experience vision problems, and it's important to contact your eye doctor if this occurs. It's important to discuss reliable forms of birth control with your doctor if you become pregnant or plan to breastfeed while taking this medication. When taking Microgestin Fe tablets, it's important to be aware of potential drug interactions that could affect how the medication works. Some medications, such as aromatase inhibitors, fezolinetant, and certain hepatitis C combination products, may interact with Microgestin Fe. It's also important to be cautious with drugs that can decrease the effectiveness of hormonal birth control, like griseofulvin, modafinil, and HIV drugs. If you start any new medication while taking Microgestin Fe, it's crucial to inform your doctor and discuss the need for additional reliable birth control. Additionally, be sure to let your doctor know if you experience any new spotting or breakthrough bleeding, as these could be signs that the birth control is not working effectively. It's also important to be aware that Microgestin Fe may interfere with certain lab tests, potentially causing false results. Be sure to inform all medical personnel that you are taking this medication. If you or someone you know has taken too much Microgestin Fe tablet and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. Always seek medical attention if you suspect an overdose. It's important to remember that Microgestin Fe should not be shared with others. When taking Microgestin Fe, it's important to have regular complete physical exams, including lab and/or medical tests such as blood pressure, breast exam, pelvic exam, and pap smear. It's important to follow your doctor's instructions for examining your breasts, and to report any lumps right away. It's also important to keep all medical and lab appointments. If you have any concerns, be sure to consult your doctor for more details. If you miss a dose, refer to the package information for advice on what to do next. It's important to use backup birth control, like condoms or spermicide, to prevent pregnancy if you miss a dose. If you have trouble remembering to take your pills as directed, talk to your doctor about switching to a different form of birth control. When storing Microgestin Fe tablet, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a place that's not the bathroom. And always remember to keep all medications out of reach of children and pets. Also, don't flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly dispose of it when it's expired or you no longer need it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.